presentation on ALS. ALS is a progressive neurological disease that causes degeneration of the upper and lower motor neurons of the motor cortex and affects nerve cells in the brainstem and the spinal cord and does not affect the meninges. It leads to atrophy of the white and gray matter of the brain and eventually inability to control voluntary movements such as walking, speaking, and breathing. There is sporadic ALS, which there is no clear cause, and inherited ALS, which is passed down.
So when talking about the cellular mechanism of ALS, ALS can cause all of these symptoms and more. These dysfunctions can lead to motor neuron death. This then disrupts many features of the somatic and autonomic nervous system. There is a potential link between the glial cells of the nervous system and the motor neuron death observed in ALS, specifically the astrocytes and microglia, which experience astrogliosis and microgliosis respectively. There's a potential connection between the Schwann cells of the peripheral nervous system and the ALS, as there has been a discrepancy in myelinated sensory neurons observed in ALS patients, but there's not enough definitive information to tell. Here is a video, an animation from Visible Body showing how ALS causes death of motor neurons and in turn, muscle atrophy.
So there is no proven contributing factors to ALS, but factors that have been highly correlated with the disease. Genetically, only about 10% of patients have a risk gene passed down called inherited ALS. Some of these risk gene mutations that have a known correlation to ALS. The other 90% of the patients have sporadic ALS. Some possible occupation and lifestyle influences, such as past service in the military, exposure to heavy metals, patient's BMI and nutritional state, as well as a history of smoking. The global prevalence is fairly low, showing that it is a rare disease globally. Some demographic factors include men are more likely than women to develop ALS, but equally likely if it is a familial, meaning that it is genetically inherited, or onset is usually during middle to late adulthood and more prevalent in Caucasian people.
As for symptoms, ALS is a progressive disease and the early symptoms differ as the disease advances. To start, early symptoms which are present in the peripheral nervous system include things such as muscle twitches in the arms, legs, shoulders, or tongue, and some more I listed on the slide. As the disease progresses, the symptoms worsen and can lead to problems drooling, issues speaking or forming words, etc. Finally, ALS symptoms also greatly impact motor function, speech, and cognition, like having issues comprehending and spelling things. As for treatments, there is no cure, but doctors do. Oh, go ahead.
As of now, ALS is always fatal, and most patients succumb to the failure of the autonomic nervous system within 2 to 5 years after diagnosis. Pictured to the right is the phrenic nerve, which innervates the lungs and diaphragm to breathe. ALS starts affecting the phrenic nerve early, and eventually the ability to breathe independently is lost.
As for treatment, there is no known cure, but doctors do have some treatments and therapies that can slow down or ease the symptoms. As you can see to the right, I named all the drugs that were approved by the FDA to treat ALS, including drugs that are used to prevent nerve cell death by blocking stress signals in cells. As for motor symptoms, doctors recommend different therapies such as physical and speech therapy to help maintain physical skills needed to perform everyday tasks. And the last treatment that doctors have been doing is having patients participate in clinical trials. There are 3 different phases. However, not all people struggling with ALS can take part in these clinical trials. However, there are different phases.
So ALS is an extremely difficult disease to research and diagnose, but new developments are often made, such as an app that can detect change in speech or stem cell therapy treatment for the actual disease. ALS advocacy and research must continue, as its prevalence is projected to increase by around 31% by 2040. Here's a more detailed map showing the prevalence of the increase, and here are references. Thank you.